Okay, what's up? Today I'm going to be talking about the cardiac cycle. Basically, I'm going to go over 7 major steps in the cardiac cycle, describe what happens to 3 major things during each part of the cycle. So what happens in the aorta, what happens in the atrium, and what happens in the ventricle, mainly the left atrium and left ventricle. Okay, whatever happens there is what's very similar to whatever happens on the other side. All right, and so 7 stages of the cycle, and in each stage of the cycle, you have to really pay attention to what's going on in all these 3 chambers. Okay, and after that, I'm going to draw a graph and graphically depict what happens during each phase of the cardiac cycle. Excuse me. All right, so first thing I'm going to start off with is what is one cycle, by the way? One cardiac cycle is actually one systole and one diastole.
Oh, yeah.
Okay, that's it. So one pump and one expansion is called one cardiac cycle. Okay, so we'll begin with the left atrium contracting, and then we'll go through each step, and we'll come all the way back full circle to back to where we left off, where the left atrium contracts. All right. So first things first, I'm going to draw. Actually, I'm going to draw all of this on one board, so hopefully you can all see this. Alright, so this is my very rudimentary drawing of the left side of the heart. You have the left atrium, left ventricle comes out to the atrium, the aorta, and then it connects back in. So here you have your valve, tricuspid, and here you have the aortic valve. And so during this phase, the aortic valve is closed. This is the first part where the atria is contracting. So here's when you would see the P wave on the ECG. I'll go over this later. And so I'm going to draw this in red so it's easier to see. Okay, so here you would have the mitral valve open, and so you have your atria now contracting. This is the first step, and you have blood flowing in, but there's already 80% of the blood, 80% of the ventricle already filled. And now I'll go over this later why this is already filled, but it's for now it's important to recognize that 80% is actually already filled, and this has to do with the I'm forgetting the name right now, but I'll go into it. It's actually called the end systolic volume.
The EVV.
Well, ESV plus a couple of other steps, but I'll go over these steps a little later, and I'll show you why 80% of the blood, 80% of the ventricle is already filled. Okay, so first step, you have your the left atrium contracting, the mitral valve is open, and you have what's called an A wave. Okay, this A wave is basically like so, and it's not an electric, an impulse wave, an electric impulse wave. It is actually a mechanical wave, and so it represents the amount of force that the atria is generating, and it generates what's known as the A wave. That basically indicates increased pressure in the atrium. Okay, and so now what happens is, since this valve is open, the ventricle now receives all that volume and all the pressure that the atrium is generating. So basically what you want to think of is whenever a valve opens, whatever the valve is connecting, both of the structures are now linked. So whatever the changes in pressure or volume that happens in one structure is automatically linked to whatever happens in the other structure. So here the atrium and the ventricle are linked when the valve is open, and so all that blood is transferred over to the ventricle, and you'd have what's known as the A wave. Now that's what happens in the atrium and the ventricle. Of course, we have to look at the third part, which is the aorta. Now the aorta is closed, so you do not have any of this pressure or volume transferred over to the aorta, but there is still pressure maintained within the aorta, since the aorta is an elastic vessel, and it is still squeezing the blood that was put into it during the initial systole, okay, or the contraction of the ventricle. Okay, now what happens is the electrical impulse that was generated at the SA node, after the atrium receives it, goes into the AV node, and from the AV node it travels over to the ventricle. Okay, so now once the ventricle receives that impulse, it's going to contract. Okay, and so this next step, it's very important in sort of understanding what's going on. So here you have the atrium. Once again, it connects to the aorta, and see the aortic valve is still closed, and I'll go over why it's still closed, but now the mitral valve starts closing. Okay, now why is the mitral valve closed? What is exactly now? Since it starts contracting, what happens is here initially, whenever you have movement of blood from one chamber to the other, it's indicating that the pressure in the chamber which it starts is higher than the pressure in here. Now, here, let's say the pressure starting, it was around 0, okay, 0 millimeters of mercury. What happens is when it starts contracting, okay, it reaches around, let's say, 5 millimeters of mercury, okay? When it reaches that 5 millimeters of mercury, it's actually going to be higher than here. So let's say the atria only generates about 4 millimeters of mercury of pressure. So once this pressure gets higher, the valve shuts closed. And now we mentioned that the aortic valve is still closed, and that is because the pressure in the aortic valve is still higher than the ventricle. Okay, so the pressure here is still 80 millimeters of mercury. Now that is actually the diastolic pressure that we measure when we do the blood pressure cuff measurement. That's actually the lowest pressure in your aorta. Now that pressure rises all the way up to around what? 120 usually on average, right? But it varies with people. But anyway, that change in pressure is actually generated from the ventricle, and that pressure is transferred over to the aorta. Okay. But during the second phase, as you can see, both the valves are closed because of the differences in pressure, as I mentioned. And as the valve contracts, as you can see, blood is already filled in here, but there is no change in the volume. Okay, so the volume stays the same. So this phase is called the isovolumetric contraction phase, and it is also where, since the mitral valve and the tricuspid valve on the other side closes, okay, since those valves close at this point, this is where you hear the first heart sound, or the S1. Okay. The mitral and tricuspid valve produce the S1 sound, and so this is where the initiation of systole begins, and so this is isovolumetric contraction. Now I mentioned what's happened in the atrium, ventricle, and aorta. Okay. Now since the pressure is constantly rising in the ventricle, and soon enough the pressure is going to be well above what's in the aorta, and that the valve is going to open. Now all during this stage, the atrium is actually being continued to be filled with blood from the pulmonary veins, okay? And that blood is going to accumulate, and we're going to talk about what happens to that next. So the next step, obviously, exactly, very good. So what happens is the aortic valve now opens because the pressure in here is what compared to the pressure in the aorta? Exactly, the pressure. Yeah, that's a little deformed part, but excuse me there. All right, so the aorta valve now opens because here it says it's 80. Now this pressure has been constantly rising because the ventricle is still contracting. Okay, and you get, let's say it goes from, you know, it was at 5 or 0, from 0 to 5, and from 5 it goes all the way up to 80. And once it hits 80 and it goes to, let's say, 81, this valve opens and the blood starts gushing out into the aorta, and the aorta bulges out. Okay, it's an elastic vessel. This is where you see that Windkissel effect. Actually, this is where the Windkissel effect initiates, where the aorta absorbs all that volume and that change in pressure and stores it elastically So when it closes, when the aortic valve closes, it still has that elastic pressure, and it's just going to recoil and squeeze the rest of the blood out. Okay, so what's happening in the three things that we mentioned was important in the aorta? Well, the aorta is receiving the blood. Okay, pressure and volume change is being transmitted from the ventricle to the aorta. In the ventricle, the blood is being transmitted to the aorta, as I mentioned. And in the atrium, what's happening? It is still receiving all that blood from not the superior and inferior vena cava, but the pulmonary veins, okay? So here you have your lungs, overlooking lungs, but anywhere from the lungs, blood is still being filled in the atrium, okay? Now, if we're going over these pressure waves, the first wave is called the A. This is just for the atrium. The second part right here, since this ventricle closes, it bulges, makes the mitral valve bulge up, and it creates the C wave, okay? And so I'm going to draw the A wave again. It creates this tiny bulge, and that's called the C wave. And now if we continue this over to here, we have the A wave, the C wave, and now slowly the pressure is once again starting to rise in the atrium. We have the A, B, and C, and then slowly this is rising. This is called the V wave. Okay, this is once again, this is a mechanical wave and not electrical. That's the third part. Now going into the fourth part, I'm going to go ahead and draw it down here. This is called the slow ventricular ejection phase, and I'll explain why that is. Here you have the atrium, ventricle, aorta. Now this the ventricle continues to squeeze out. The valve is still open, but blood is going out slowly. Okay, diastole is the next phase that's going to happen. So the ventricle is still contracting, but it's the final phase of contracting. So blood is slowly going out. Okay, and this valve, the mitral valve, is still closed, and blood is coming into the atrium from the lungs, and it's still acting as that reservoir of blood. Okay, and so here, let's say the pressure was 120. Now it's slowly starting to come back down. Okay, and so once that pressure, okay, comes back down to around 80, this valve is going to close. Okay, so the aortic valve is going to close. Okay, this valve continues to stay closed here in the atrium. Here you have your blood that's being filled up. And so once this reaches to, let's say, around 79, now the aorta, you have to remember, it contained all that blood, and so now it's continuing to push or squeeze the blood. It's going to maintain a high pressure, okay? So once the ventricular pressure reaches below the aortic pressure, let's say the aortic pressure right now is around 100, and so this is around 99, this valve is going to slam shut. Okay, and so once that valve slams shut, you're going to prevent the blood from continuing to seep out of the ventricle into the aorta. Okay, and so this is where the ventricular diastole starts happening. This is also when the valve shuts, is S2, or second heart sound, the dub. Okay. Once the ventricle starts relaxing, another important thing, once again, you have to notice that both these valves are closed, and whenever both valves are closed, it's important to remember that something isovolumetric is happening because nothing is changing in the volume. Okay. One thing is important to remember is that the heart doesn't pump out all the blood. Okay, there's still some blood that's left over in the heart, and that's actually called the end systolic volume. Okay, so after this phase right here, when this slams shut, there's still a little bit of blood. Okay, this is called the end systolic volume. Anyway, as I was referring to earlier, this volume doesn't change. Okay, as the ventricle starts to relax, okay, and move out, this is called the isovolumetric relaxation phase. So we had the second step right here was the isovolumetric contraction. Okay, that's the beginning of S1, and now you start noticing that pattern. The beginning of S2 is where you have isovolumetric relaxation. All right, and so the next step, obviously, is ventricular filling. The first thing that happens, though, is we need to take a look at what's going on in the atrium. Okay, so all this time the atrium was being filled up with oxygenated blood from the lungs, right? So there we have the atrium. Okay, and so these are shut closed. Now let's look at each of the areas. So the atrium, I'm sorry, the aorta is still it's going through the Windkissel effect, where it has all that elastic energy and it's squeezing it in, ejecting the blood out. Okay, and so it's continually decreasing in blood pressure. And so at a certain point, okay, when the ventricular pressure, as this undergoes relaxation, goes below the atrial pressure. So let's say the ventricular pressure reaches around, I don't know, 1 or 0, okay, and the atrial pressure is higher than that. It goes to, let's say, 4 or 5. The blood is going to, the valve is just going to open up, okay? Yeah, it's just going to real quickly open up, and this is called rapid filling, okay? But it's called rapid passive ventricular filling because you have to notice that the atrium does not contract, okay? As the pressure in here drops, the change in pressure is so high that the tricuspid valve just opens up and the blood just starts flowing in. So here you had the end systolic volume, and now you're having this rapid passive ventricular filling, okay? So now keep in mind that the blood is constantly being filled up in the ventricle, okay? Even before the atrium opened up, there was still end systolic volume in here. Now we're going to go into the importance of why we need to have that end systolic volume in a later lecture. It has to do with the preload. But anyway, moving on from here, you have the atrium now. It's releasing all that blood from the lungs. The ventricle is collecting it, and the aorta is contracting. Now, if we go over to the pressure waves, we'll notice that obviously we had the A wave, okay, and then we had that tiny C wave where the ventricle contracted, and then you had the V wave where the pressure was rising as the tricuspid valve was closed, but at a certain point when the tricuspid valve opened, bam, you had that decrease in pressure, right? And so you have the blood being filled into the ventricle, okay? And so obviously the next step in the cycle, it's going to be actually continued filling, because what happens is the atrium is still connected to the lungs, right? So here you have the atrium, okay, and the atrium is still connected to the lungs while the ventricle is still undergoing diastole, right? So notice how most of the time the ventricle is in diastolic phase, okay? That's why the majority of the time you're in diastolic phase, and it's only a tiny period of time where you're in the systolic phase where your heart's actually actively pumping. All right, and so anyway, it's still connected to the lungs, and blood from the lungs through the pulmonary veins is actually directly putting blood in. So you had the end systolic volume, had the rapid passive filling volume, and then now finally you have your slow passive ventricular filling volume as the pulmonary veins continue to drip the last few drops of blood into the ventricle, ready for the next squeeze. And so now this is where the AV node conducts and the ventricle once again gets the impulse, and bam, you're back to the beginning where you have that the atrial contraction, and then you have the blood going in, and obviously you have the ventricular contraction. Okay, so this is actually not where the atria initially opens up and releases blood, but this is where the atria is squeezing out the rest of the blood. So that's why it's called basically kicking out, kick start. So squeezing out that extra blood. So technically, even if you had a weak atrial contraction, you could still continue to live. Okay, that's why people with atrial fibrillation, where the atria is not fully contracting, they can do day-to-day normal things quite easily, but when oxygen and blood and nutrients are in demand when they're doing exercise and such, they'll have a hard time, because that's when you really need that atrial kickstart to squeeze that 30 to 40% extra blood into the ventricle, so that you can have appropriate tissue perfusion. Okay, and I hope you can see that. But anyway, so yeah, that's how the cycle connects back. And now I'm going to do a graphical depiction of all of this, just so we can have a better understanding of how everything happens together. All right. Take this out. Okay, so I'm going to go ahead and have a huge graph. X-axis, where I have my Y. Okay, and so first off, I'm going to start with the atrial pressures, and then from there we're going to go into what happens, with the electrical impulse, what happens with the volume, and then what happens with the, in the ventricles. All right, and so obviously the first thing, as we talked about, we mentioned was the atria. Okay, the atria initially contracting. Okay, filling in with blood, and so that's when you have, let's say this is around 0 millimeters of mercury of pressure, and up here you have around like 80 millimeters of mercury. And anyway, so here you have, let's start off with the atrium. So you have that initial rise, that bump right there. And now, obviously, when this valve opens, all that the pressure is going to be transferred over to the ventricle. And so, right down the ventricle. I'll draw the ventricle in red. And obviously, the ventricular pressure is going to go along with it right there. And that's that initial phase. Demarcate. It's the end of that first phase, and now what happens is the valve closes shut. Okay, and so valve closes shut. Both the valves are now closed, and there's that isovolumetric contraction. So here is where you have S1. All right, and so what happens here? So I'm sorry? Yes, this is the beginning of systole. And so what would happen in the atrium? The atrial pressure receives that tiny bump that we mentioned, okay? And now the atria is continuing to fill with blood, so the pressure continues to rise here. Sorry, I shouldn't go too high. Anyway, the pressure continues to rise there. And what would you say happens to the pressure in the ventricle? Exactly, right? So it reduces significantly because the ventricle is now contracting. There is no change in volume, so obviously you'd have a you'd have a spike.
Like up to 120 kind of thing?
Yeah, this is where you have that spike, and it would go all the way up to 120. But initially, it would go to around, let's say, 80. Okay. And now we need to look at the pressure in the aorta. So we've neglected the aorta so far. But let's say initially the aorta, we mentioned that the aorta had around 80 millimeters of pressure. And so the aortic pressure is going to, once it really, as soon as it closes, it continues that Windkissel effect. And so the pressure is rapidly dropping. But still the pressure is higher than it is in the ventricle at this point. But once the ventricle reaches, let's say it reaches 80, okay, when it meets that aortic pressure and it goes even higher, that's when you have the opening of the aortic valve. So I'll demarcate this. Okay, and so now what happens to the ventricular pressure at this point? So now you have the opening.
You're going to continue to go up a little bit.
That's right. So now you have atrium, valve is closed, ventricle. Okay, the valve is now open. Blood is being squeezed.
The rapid ejection.
Yep, this is the rapid ejection phase, and you have that ventricle now really squeezing, and so you have this this pressure where it's still increasing. Okay, so you have the ventricular pressure, which is increasing. Now I mentioned the atrial pressure is still increasing because it's receiving blood from the pulmonary veins. And now, what would happen with the aorta? Since that valve is open, it receives all that change in pressure from the ventricle. Exactly. So it's going to travel right along with it. Okay. So now the aorta is going to receive that high pressure. Let's say 120.
Okay.
All right. And so that's going to continue, and then we'll go on to our next phase.
That's the slower injection.
Exactly. So now this is where. Yeah, this is where it's going to slow down a little bit because this is the end part of the ventricular contraction. Okay, blood is still being squeezed out, but very slow. So now, what would you expect? What would you expect would happen at this point with the ventricular pressure?
Starts to come back down.
Exactly, the ventricular pressure would start to come back down. Okay, and now obviously since that aortic valve is open, it's going to
Do the same thing.
do the same. It's going to go right along with it.
And
Okay.
so that's the end of like systole right there.
Basically, that's the end of systole. Yeah, exactly right. And so now you still have this
Increasing.
still having that increase in pressure in the aorta because blood is still continually flowing in. And let me go ahead and demarcate the end of this phase. Now, what would happen next after the ventricle? After
That's the isovolumetric stepping.
exactly. So now this is the phase where now the ventricular pressure is going to be lower than the aortic pressure. Okay.
Okay.
So now at a certain point, ventricular pressure gets lower than the aortic pressure, and so the ventricular pressure in red, as I marked, is going to
Go down a lot.
come down. Okay, and then you're going to have the aortic pressure. Once the aortic valve is closed, it's going to continue like so because the valve is closed, but now the aorta is bulged and it's continuing to push. So that pressure is going to slowly go down, but not as fast as the aorta. So it's going to continue to push all that blood out into the tissue. So here you have the atrium.
This is where you hear second consonant.
Right, exactly. And so now you have that close, and the beginning of the close, diastole, this is where you hear S2, the dub, okay, as blood stops flowing to the aorta from the ventricle. Now, moving our focus back to the atrium, blood is still going in, so blood is continually rising, and at a certain point, the pressure in the aorta is going to be higher than the ventricle, and the tricuspid valve is going to open. So at that point, it's going to reach that point again.
And that's going to be the next phase.
Yep, exactly. It'll reach that point, and it's going to come back down. So here you have the A of the atrium, C, and the V. It's going to come back down, right?
Okay.
And so go ahead and demarcate that.
Now we're at the rapid filling part.
Exactly. So now we're in the rapid filling of the ventricle. So now the aorta opens, blood is flowing through. Okay, both these valves, actually the aortic valve is closed, but the tricuspid valve obviously is now open. And so blood is flowing through. Remember, we had this end systolic volume here. Not all the blood is pumped out. So here you have the rapid filling. Now, what do you think would happen to the pressures in the different areas? So you'd have your...
All going down, aren't they?
Exactly. So they'd all continue to go down. So obviously the atrial pressure goes down, ventricular pressure continues to go down, and the aortic pressure continues to go down,
But not as much.
but not as much as the excuse me, not as much as the ventricle. That's why you have that closed valve still, okay? So finally, you're in the slow filling, okay? So this is where the valve is still open, and you have from the lungs, the blood is finally directly flowing in. Okay, now you have that slow filling, and once again, the pressure is continuing to drop here.
Well, it's still dropping back here, or is it just kind of like staying?
Well, since there isn't any contraction, the pressure actually continues to drop. Okay, so in the aorta, there's that ending of the squeeze, so pressure is dropping. Ventricle, it's undergoing diastole, so pressure is dropping. And the aorta obviously is not squeezing right now and still being open, so pressure is dropping.
Just not cooking.
Exactly. And so now this is the point where the SA node once again fires. Okay? So boom, and the cycle starts all over again. Say SA node fire, okay, and you'd have that increase in atrial pressure. That A wave, we're back here again. Okay, and now since you gotta remember, since that valve is open, ventricular pressure jumps right along with it.
Yeah.
Okay, but not, it doesn't pump any blood out, and obviously.
So nothing's happening with our. Yeah.
Yeah, so the aorta continues. Anyway, you'd have the cycle all over again. And basically, that's the gist of what happens so graphically. Now, I'm just going to overlay the ECG on it. Now, where do you think that P wave would be? I already mentioned it, but there's that SA node firing. So it would actually be what? Before, during, or after the A wave? Yeah, it would be right before the A wave, right? So here's the P wave of the ECG. You need that SA node firing first before the A wave, the atria contract. Where would you find the QRS complex?
Right at the start of the isomol.
Exactly, all right. So you'd have that QRS complex right there. Okay, you need the start of it before the ventricular increase in pressure because you need that impulse to generate that contraction. Okay, and so this continues, obviously, and then you'd have the repolarization. Yep. And then once again, obviously, right here, you'd have the P wave again. So P, Q, R, S, and then you'd have the T, where it's repolarization, all right? And so now, if we're going to talk about the volume, it's very simple.
Can you get the ground mark?
Yep. So now let's talk about the volume. The final note. Let's talk about the volume in the ventricle. Okay. Here, volume is low. It is continuing to fill. Okay. All the valves are closed. Okay. So there is isovolumetric contraction, as we mentioned during that first sound. So it's going to stay constant. Okay. And now here. We'd have that opening of the aortic valve, and so yep, one's going to go down, but it's not going to empty all the way. Okay.
It's going to like slope.
Yep, it's going to slope kind of down, and now here you'd have, since the one's going to go down, but you have that isovolumetric relaxation, so we continue to stay the same, and then slowly you'd have that filling. Obviously, the cycle is going to continue. Okay, so it's very simple. There you have it. I hope you can see that. And that would be it.